It's good. Oh, let me turn my cell phone off and make sure it doesn't interrupt me. Good to see you. We have a number of people here live today, and I know that many of you are joining on TV, either live stream or Channel 991. I know that because I get a report each week telling me how many people tune in to each event that we have on TV. And I'm honored to say that this talk I give every week is highly attended. It probably means that people want to hear what I have to say, but I'm not worth getting out for and coming down here. And that's okay. It's just to communicate information, and however you get it, I'm happy to give it to you. Interesting things going on out in the world right now. Nationally, COVID is improving quite a bit. I understand that, they've been talking about how they wanted a 70% vaccination rate in order to get herd immunity, and that would still be a good goal, but health officials are now thinking as long as 50% of people have at least one dose of the vaccine, that will be enough not to eradicate COVID-19, but to get it under control. And that might be what we're seeing here. In the United States, about a third of the people are now vaccinated, fully vaccinated, and more than that have gotten at least one dose. The FDA and CDC and those that make such decisions have been lowering the age of people who can get the vaccine. It was lowered to 16, and I believe it heard now it went down to those that are 15 years old and older can now, sir? 12 years old? Okay, that's even better. So that'll start getting a lot of students vaccinated. But we are seeing vaccination fatigue, I guess, in that I guess the people that really wanted it have gotten it, and now it's a little harder sell on those that are remaining. Vaccination levels across the country are leveling off and dropping some, as we're also seeing here locally in Shelby County. On January 8th of 2021 in the United States, there was a new all-time high of new cases for that day, just a little over 300,000 new cases in one day. Then it started declining, and within about 4 months, it was down to about 80,000 new cases per day. And a couple of days ago, we were down to about 50,000 new cases in the United States. The majority of those now are younger folks, and I think it's because most older people above even 60 or 70 have received the vaccination. They've had a really good take rate on seniors, so that's helping a lot. And in fact, I heard a statistic yesterday, some people argued it, but I think the consensus now is that of the new cases nationwide, about 22% are children. And I think that would involve teenagers on down. They didn't define children, but probably minors, if I had to guess. Here in Tennessee, in early January, we reached a high of nearly 11,000 new cases per day, and now it's down below 1,000 new cases per day. So we're seeing really good improvements, believed to be primarily attributable to the vaccine being out. There's still concerns as to whether the vaccine is effective on all of the new strains that are coming out. It's known to be effective on a couple of them. Some of the others are fairly new, and it hasn't been proven yet either way. That's one reason we're still encouraged to be careful, wear masks, avoid crowds, and that sort of thing, because they don't know a lot yet about the new variants that are out there. Here in Shelby County, we had in mid-February, well, as I mentioned, we started out about 1,000 new cases. There have been 1,000 new cases per day in early January in Tennessee. In Shelby County, we got down to a low of about 38 new cases per day in mid-February, but now it's back up to about 150 on average. So we've had a spike here in Shelby County for various reasons, and also vaccinations are really down in our county. We got that federal program at the Pipkin building at the old fairgrounds that had a capacity of thousands of doses per day, And you know, they're talking about should they just shut it down and leave because so few people are taking advantage of that, and we have so much more capacity than people are using. The 14-day positivity rate is 5.3% now, about the same as last week. That puts Shelby County in the yellow zone, according to CDC measurements, and we need to be below 5% to be in the green zone. We had gotten down to about 3.5%, I believe, at the lowest point. Here at the Village, we're continuing to test weekly. And then on Friday of last week, because of some positives that we had on Tuesday, we tested again on Friday. On Friday, there were no new positive cases. I mentioned in my letter that on Tuesday of last week, we had 5 employees who tested positive in various areas, and that was really high, unfortunately, but Friday we had none, and today we haven't yet gotten the results from yesterday, but yesterday we tested everyone, and we'll see how those turn out. I will put that information in my letter that comes out tomorrow. As always, you know, just monitor yourself. If you do have any symptoms that could be COVID, you know, let us know and we'll get you tested, or you can see your doctor and just make sure that you stay safe. Activities here, I tell you, I keep getting favorable comments on the mayor's talk last week, and it was really good, and it was good to see him out. And Mr. Klein, Jerry Klein, got him here, and I appreciate that. And Jerry is our governmental affairs officer here at the Village and is also our personal lobbyist. So he knows everyone in the government locally and is a big help to us and keeps that relationship up. And thank you for bringing the mayor to us. And I think Jerry knows everybody because he's also you know, gotten a couple of others lined up soon that are, you know, Calkins, for example, is coming, and he brought him here, and, you know, some people that might not give us the time of day otherwise, so thank you for that. In addition to the mayor's talk, we're continuing to have different types of music events, and I was told by several people that the last 2 Friday nights are probably the best music entertainment that we've had in a long time. And I'm seeing heads nodding here, and I'm glad that we're finding good entertainment that you like, and we will do our best to keep that up. Today is Cinco de Mayo, and we're going to have one of our first bigger parties. We're going to try to do it with minimal mingling, so it's going to be a seated meal here at between 2 and 4 o'clock. And I know 2 o'clock is an odd time for a meal, but somebody said, "Why are you doing it at 2 o'clock?" I said, "Why not do it at 2 o'clock?" And that seemed to suffice. They understood that and agreed, so I'm going to keep using that. But one of the big reasons, honestly, is that we wanted to have the mariachi band entertainment, and we couldn't get them except in the afternoon. They are really busy today, as you might guess. I don't know how many of those there are in town, but there can't be very many, and they're in big demand, but they were available for the afternoon, so we took them, and that's why we're having that. The Monarch will be closed tonight at dinner because we are using the Monarch also for this meal. It will be seated, and I know it's going to be a full meal because Maria used the word platter when she said that each person that's seated at the table would get a platter of Mexican food. So I'm going to try to see if I can sneak in and get one as well. It sounds really good. We have some other big events coming up. We've mentioned the outdoor party and grill type event that we're going to have on May 26th. We're going to have a band there, sort of like we did for the 15th anniversary party. Since then, I know at the time we had some sound issues, and since then we have run some additional electrical capacity out to that area, and they can have speakers that also face outward instead of just forward. And I think there will be enough electrical current this time that it won't keep throwing the breakers. And you know, we're a year smarter now than we were back then, so I think it's going to be really good. We're seeing a lot of people get out to events, and that's great. You know, we talk about how to do it safely, and that's important, but it's also important to get out and enjoy ourselves and socialize and get back to some fun events. I believe all the fitness events are now back in the aerobics room. Most people find that to be a good thing. A few have told me that they like to just sort of walk by and watch and see if it's worth dropping into, so those people wish it was still here. But in general, I think it's better in the aerobics room, and most people have been happy about that. Bingo is back, as you know. We had that the other night, and I wasn't here for it, but I was told it was a really fun event, and people really enjoyed that, so I'm glad we could bring that back. That used to be the most highly attended event that we had during the course of a month, and I don't know if it'll settle out that way again or not, but it'll be interesting to see. Just a reminder that many events are still being shown on TV, either Comcast Channel 991 or live stream. I've mentioned before, some of the music programs we're not putting on TV now, which is a shame because I'd like everyone to be able to enjoy them even in your apartment, but at the same time it's really hard to do in a way that it provides a good quality experience, and we'd rather not have it than to have it and it be frustrating and not done well. And it also, a lot of times, the speaker systems will interfere and it messes it up for those that are here in person. So that's why we're not showing some of those on TV. One thing we're going to go ahead and change, we've been asking, you know, visitors are welcome to your homes, but we've been asking them to stay out of common areas. And we're going to relax that at this time. So if you have visitors and you want to meet in the lobby or walk up and down the hall and see who you see, that's okay. They can go to the clinic with you for an appointment if you want that. The two things that we ask right now in the hallways and common areas, they still need to wear a mask. Some visitors are vaccinated, some are not, and it's just more important that in those situations they and we wear masks in common areas. And secondly, we can't open up the dining venues yet for visitors. I'm hoping that won't be long, but not yet. Other than that, they're welcome. Keep in mind the changes that we've made. I'm hoping we will continue to be able to further loosen restrictions, but if things get bad again, just know that we'll have to tighten up again, and we will be adaptable to conditions here and outside the community as we need to be. So let's hope that doesn't happen. Just understand if it does. Tomorrow begins National Nurses Week. It's May 6th through 12th. And in a place like this, especially over in the healthcare area, nurses are very important to us. And we're going to honor them in various ways, including bringing in some meals for them and having other ways to recognize them. We're going to try to do something different every day. And for a week, we're going to give special honor to our nurses. CNAs will have a week later as well. So if you do see a nurse starting tomorrow, or any time for that matter, be sure to express your appreciation for the service they provide. It's really important to us. Yesterday, we had a meeting of all the nursing staff as well as others that work in the healthcare areas, such as housekeeping, dining, what have you, those type of folks, and gave a special recognition to those that have been there for the entire period of the COVID pandemic. You know, it started in earnest last March, so it's been roughly 14 months. And we had quite a list of people who have worked in the nursing center continuously since March. And they are truly heroes, because some people said, I just can't deal with it, can't handle it or accept the risk, and they left. Some of them left their field because of this, and it makes us really appreciate those that stuck through it and helped us get through the last 14 months. We sure couldn't have gotten it without them. We gave them a commemorative pin that said something along the line of being a healthcare hero, and I hope they wear it. And if you see one wearing that, you'll know that they were one recognized for the last 14 months. We have, today is the day we announce an Associate of the Month. Let me just go ahead and mention, I've gotten a couple of recommendations from residents, and those came after we had made this selection, and we will consider them for next month. So thank you for doing that. This month, it's somebody that you probably don't know. He is an LPN and works in the healthcare area, and he works from 3 to 11, I believe is his shift at night. As a result of that, many of you won't see him, but his name is Gage Bishop Snyder. And Gage does an excellent job for us. He is just the epitome of what you would want in a nurse. You know, the administrative things, he's always on time. He's such a team player and works so well with everyone. He pulls extra shifts when we have a need, and he wants to. He's very attentive to the residents in meeting their needs, and just gets so many compliments on the service he provides. Now, those are all things that we hope every nurse would be like, and in selecting an Employee of the Month, we try to find those that do something above and beyond just the normal expectations, and Gage did this month. There was a particular evening when staffing became really challenging. I don't know if y'all have noticed all around town and everywhere you go, it is hard to find staff right now in so many areas. Honestly, the federal government incentives on unemployment have made it very hard. It's sad, but a lot of people have the mentality, if I can make that much sitting at home, I'm not going to try to work. And that's really unfortunate. It makes us appreciate the ones we have. I went into a restaurant the other night, and they had a sign on the door. We have very few staff, expect slow service, and don't expect refills quickly. And I appreciated their honesty. But that's pretty much what you see in any restaurant around town, and some of them don't even open for certain meal periods because they don't have staff. My point is that staffing is difficult everywhere, including our industry and including here at the village. So when we had this particular challenge, Gage took it upon himself. It's not his job to figure out staffing issues and fix it, but he took it upon himself to say, all right, this evening, here's the problem, and let's see, what can we do to fix it? And he got it all worked out on the schedule with some others that needed to cooperate and all. And by the time the nursing management staff found out about the staffing issue, he had it all fixed and planned out. And he did a great job of it. So that was really significant of him to do that at this particular time. So anyway, thanks to Gage, and we'll be honoring him a couple of ways among the staff as well. You know, along the staffing line, it just goes to show really one of the things that staff like about the village is the appreciation they receive from residents, and they get it in so many ways. Honestly, sometimes they don't get it from everyone, and some people aren't as understanding as others might be. Just recognize that we really need to take care of the staff we have, show them your appreciation as you always do, and let's keep it a great place for them to want to be. We do have a few birthdays this week. Sunday was Peggy Huffman. Monday was Judy Boschwit. Then we jump all the way to Friday with Judy Lax. And on Saturday, we have Louise Mann and Iris Posner. And then Sunday, Eloise Stringer. So if you see these folks, wish them a happy birthday. Questions? Yes, ma'am. I remember you mentioning that to me, and I checked on it, and I'm really confused because. Yeah, I'm not sure what happened there. I don't know if I announced it just before he was told. Some people that don't work certain shifts may not know it for a couple of days or something, and that may be it. I really don't know, but I do know that he knows, and he did after that, and it may have just been a slip up or something, but we'll be very careful about that. Any other questions? Okay, if not, thank you for coming. I'll see you back here sometime this afternoon, and wear your bullfighting costumes or whatever else you have, and I'll see you then.